Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health Livestream with yours truly. It's a little bit of a dysfunctional. Usually I can hear the program and today I can't hear it, but I'm being coached and told that it's working the way it's supposed to. So hopefully you can hear me as clearly as I want you to hear me. And we're going to talk a little bit about a continuation actually of what we just got done doing on WMAL. So we're talking about dementia. And I want to cover a couple of different topics about that and make sure that you understand that this very feared situation, 80% of the population fears some sort of dementia pattern as time goes on. And what I want you to know is that it's not necessarily something that we have to incur, that we have to make sure that, we have to prepare for. We have to prepare in this way like we would for any other optimization of our health. We want to make sure that we're taking the steps to make sure that we have all kinds of immunological support and we have neurocognitive training that goes on. And what I mean by that is continuing to learn and increase the neurological patterning between, one part of the brain and the other. So, years ago, there was thought that the brain did not have a waste elimination system called the lymphatic system. And in the work that I do in neuromuscle function response testing, we saw that, in fact, that there were reflexes that seemed to be associated with the brain. So if we rubbed them out, if we held them, if we tapped them, we saw shifts and changes in the expression, if you will, of the neural capacity of brain function. Well, we know now, because of research and observations and so forth, that in fact the brain does have a very significant lymphatic system. It's called the glymphatic system, and it's embraced and known in science as if it had always been there. Well, the fact that it's there says that could be congested, it could be backed up, it could cause all kinds of problems. Now, when it comes to dementia, you've heard the terms tau proteins and amyloid proteins, and you've heard about toxic metals getting into the brain. And we know now, post-COVID, we know that people have suffered memory patterns and cognitive disorders because the viral patterns have gotten into the nervous system. Those spike proteins have attached themselves as well, but also the vaccines from good old Pfizer and Moderna and J&J and their brothers and sisters, right? Those things that we know have caused problems all by themselves. So when we take all that into consideration, we could sit here now probably for about 5-6 hours and break it down into very digestible pieces, but we're going to do that over time. The next few weeks, we're going to talk about different pieces of neurological function, dysfunction, disorientation, as they come from biochemistry, as they come from trauma. And today we're going to talk a little bit about the biochemical input, and we're all going to talk about trauma and kind of how they go back to back. Look, if you look up dementia, and you get a list of things that say what kind of dementia, and so the evidence of dementia that exists today seems to be multidimensional and extraordinarily confusing to a lot of people. In the first part of the program on WMAL, I said that we go back in observations relative to Alzheimer's, God forbid, that horrible plague that could help us or hurt us rather, and we found that there is help, that if we understand what's really being done, can begin to reverse things. First, we thought that it was a result of these tau and amyloid proteins. Now science is coming around and saying maybe not so much. Maybe there is a failure of within the synapse from one neurological input going to the next one that is being blocked in some way, and it can't transport over. If you're a child of the 60s, you remember the term pothead, right? Somebody's smoking too much marijuana and they smoked it every day. And where that came from is the slow, sluggish, both in perception and communication of the person that was always doing too much marijuana. And what we understand now, post those years, is that somebody who is using that, and it's the same for many different drugs, but it happens differently in other things, is that there's actual deposition of the THC between one neural synapse to the initiation of the next. So it slows down the transportation from one to the other, giving that sluggish pothead, if you will, type of expression. Now, there's much more to it than that there, but I want to kind of set the stage for a few things. When you have an impact, a trauma to the skull, there's an underlying irritation that occurs first in an acute situation, an inflammatory reaction, but also then post-traumatically over a period of time where tissue, we'll use the term scarring, if you will, or adhesions, or that kind of physical obstruction takes place. Again, we're not getting specific, but I will. And by the way, as I said, coming up October the 9th at the Roselle Center for Healing in Fairfax, I'm going to go through this with you, and we're going to co-teach as we normally do. But what I want to do is I want to bring out is that most of this traumatic injury, this dementia patterns, these irritations, these sluggishness, the loss of capacity can be, in many cases, made far better, if not completely reversed. And the more that you have available to you, understanding the biochemistry behind it, it's called neurotransmitters and amino acids, the more you understand how these things intertwine into the system, causing physical obstruction, the more we can go after them in an active form to be able to reverse it without drugs that make things much worse over a period of time. You know, most of the drugs that they're using for dementia problems don't work. And you have to restore the neurocognitive facilitation. If you can do that, you have a good chance of restoration. Now, here's something that most people up until recent years said was not true. And what I'm going to tell you is simply this. When there was cellular damage to the brain, it was thought that the brain could not restore, repair its format. The cells were gone, they were dead, and you didn't produce any more. Today, we know that's not true. We know that, in fact, the brain, like every other portion of the body, can restore itself. And if that's the case, then we have to understand the why behind it. And if we understand the why, then we can do something proactively to fix it. So I don't know about you, but it's got my interest. Maybe because I'm getting a little older. Maybe because, you know, I see so much in the practice, and because my patient base is getting older with me after all these years. But, you know, I have a patient right now that came in. She said, I just had an MRI done in my brain, and my brain is shrinking. Now, does that mean it has to shrink? You know, as we age, we observe that the volume of the brain, particularly the frontal cortex, this area here, begins to shrink. We laugh about young boys particularly and say they never have a frontal cortex, so they're about 25 to 27 years old. And because the frontal cortex has to do with good decision-making processes, knowing the difference between outcome, right and wrong, but not more importantly, what happens if certain things happen. Now, if brain cells are dying, then the brain will shrink. So we know that's one of the situations that does occur. As the blood supply begins to shrink because of aberrations in blood pressure, we know that ischemia, loss of oxygenation, increases, and this area of our brain called the white matter, which is underneath the gray matter, that begins to break down and the brain begins to shrink. So what we want to find out is why. Is it something that has to happen? Well, we can put together a whole lot of different things like repetitive injury, and we're talking about small blows, a shaking type of effect or a bumping effect. We're in a car, we get hit from behind, and boom, our brain bounces off the hard component called the skull bones. You got 22 of them. Or those skull bones don't move the way they're supposed to. They have little joint spaces. And as you breathe in and out, they're supposed to expand and come back together. If that doesn't happen, spinal fluid can't move, toxins can't be eliminated, that lymphatic system doesn't work the way it's supposed to. And subsequently, that oxidative stress, that inflammatory reaction, the shrinkage of the tissue around, it's called cytoplasm, by the way, begins to cause cells to die, and they're no longer able to function. So that atrophy of the brain then can shut down the ability of the cells of the brain to restore and to repair and to redevelop and so forth. Now, we need to find out what's the deal, right? Why is it happening? And so when we talk about injuries, stroke happens, for example, when blood flow to a part of the brain is interrupted. It's either ruptured, okay, so we have a bleed, blood supply ruptures, bleeds, just like in the heart, or it gets clogged up. So now, because of that clogging, there's no perfusion, if you will, into different parts of the brain. Now, traumatic brain injury is damage to the brain. And it can come, as I said, because of a lot of things, very abrupt. We see it in athletes, particularly football players and guys that are playing contact sports and the like. But there's generalized atrophy, and then there's focal atrophy. Focal atrophy affects certain cells in certain parts of the brain due to loss of something, either blood supply, sometimes spinal fluid motion is not what it should be, or there's pressure on it. Generalized atrophy affects cells throughout the whole brain, and that's when we see an overall shrinkage of the brain. Now, the life expectancy for those unfortunate patients that have brain atrophy can be influenced by a lot of different things, but people with Alzheimer's live on an average of 4 to 8 years after their diagnosis. That's not a lot, right? Because it's already breaking down. So the question becomes, can you begin to stop the progression, number one? Number two, is it possible to reverse what's being taken place? So the anecdotal clinical observation that comes from all over the world is simply, the answer is yes and no. If you can find the underlying why, you can begin to reverse a lot of the stuff. And so what do we see? What are the symptoms? Well, dementia. Some people have these underlying seizure activities. It's an abnormal electrical activity within the brain and causes repetitive movements, sometimes convulsions, and sometimes even a loss of consciousness if it's too much. Like a grand mal seizure, right? The injuries that we talked about, it happens when the injuries can cause blood flow to a certain part of the brain to be interrupted. And without that deep oxygen-rich blood that we all need to have, the neurons die. Loss of B12 and folate and taurine and theanine, low levels of certain types of nutrients can cause that to take place. So, whether we have a fall, we have a car accident, we have an injury to the head, we can see injury, we can have trauma. Have you ever watched anybody with cerebral palsy? It's a movement disorder. It's caused by abnormal brain development that starts out in the womb while the mother's carrying the child. And there's other reasons that it'll take place, but that's what we usually see. And it causes lack of muscle coordination, difficulty walking, and other movements. We've learned over time that a lot of these things can be reinstituted if the whole brain is not affected, because we know now that every part of the brain has the memory of every other part of the brain. It's called a holographic memory. And when we understand that and we can direct the patterning to it, it seems to change things. When a patient of ours has a stroke and they lose function in one arm, or they lose in the leg, or they lose it more globally, they put them through in traditional medical rehabilitation and try to get coordination back. But you know what we found? We found that supporting the body with very specific nutrients, using low energy light laser to reprogram, if you will, the photon expression of the brain. But here's an interesting one that we do with all of our patients. I tell them, when they're doing their rehab, put on a headset with music that has the same rhythm of the brain. What would that be? Like chamber music, string quartets, very gentle, very low level. But what you see almost in every case is that it dramatically increases the effectiveness of the rehabilitation and allows the patient to recover faster and to a level that they can. So when we see all kinds of neurodysfunction, we see loss of mechanical coordination, memory coordination, when we see that the incoming, if you will, the understandability of words are there, we can't connect. We go into a state of aphasia, if you will, like poor Bruce Willis right now. And, he's basically gone into his own little world. Is there a way to restore so much of what's been lost? And the short answer is yes. Is it 100%? But even if it gives you 20%, even if it gives you a stop where it stops the breakdown over a period of time. My brain thinks, this is something that we need to take a look at. So what we're going to do is we're going to start pulling the veil off of this thing. We're going to look at the different types of treatment options that are out there, particularly in our world, which I know very well and have looked at for over 47 years. And I see people, particularly, I wish I knew 47 years ago what I know today, and I would be able to help. I wish I had another 47 years on the planet to be able to learn so much more. But with the advancement of science, and we understand that this is not something that has to happen. You get people that are 100 years old, and they're sharp, they're quick, they learn, they process. Why can they do it and other people can't? What's the difference? Does it have to do with an environment that's stimulating and challenging? In many cases, yes. Does it have to do with the ability of their lymphatic system, this waste removal system, to work a little bit better? Yes. Does it has to do with they're getting enough water in their system? Yes. Does it has to do with the fact that they may be going out and getting a walk every day? Like, you've heard me say 1,000 times, go out and walk, 15 minutes out, 15 minutes back, a half hour every day, try for 2 miles, even if it takes you 40 minutes. Now, it's not the speed, it's the exercise, the movement, causing that lymphatic system to move, getting oxygenation in the system, decreasing the stress patterns. All these things cause the body to express itself in a better format. So we're going to talk more and more about that over the next few weeks. We're going to really put it together on the 9th of October at the Roselle Center for Healing in Fairfax. Join us. Program starts at 6 o'clock. Remember, you have to register. All you have to do is call the office at, go to the website, actually start with that. Go to drtomroselle.com and you can register for the class there. You can go to rosellcare.com and, you can call the office directly if you'd like to. So let's do this together. I'm of the age where obviously I worry about it, and I really don't worry about it because I know that there's so many things that are available, and I'm not about to let my brain shrink. But you understand that the brain is your master control switch. Your brain is the one that allows everything else to work all the way through. You have patterning that takes place that is back and forth communication between your body and your brain and your body. And when those things aren't working, but the one place that I'm going to really point at, that I want you to understand that you have total, complete, absolute control, is that what you put in your body that makes up the microbiome of your intestinal tract. If that intestinal system is not working, then 80% of your brain is gone. 80%. Why? Because that's where your neurotransmitters are made, and they're made from the good guys called the good microbiome of your intestinal tract. And if that's gone because of all the steroids, if that's gone because of all the drugs, if that's gone because of all the antibiotics, if that's gone because you haven't put the right foods in over a period of time, you can almost guarantee that your brain is going to go down the tubes. You're going to hit that wall, and all of a sudden things are going to change. And we're going to talk about that. We're going to get into the intimacies of what causes rapidly progressive dementia over a period of time. And remember, a rapidly progressive dementia, that means things that are moving way too fast and your brain's going down the tubes, and you go, I don't know why I can't remember that. I'm really worried about that. Might happen because of autoimmune diseases. It might happen because of neurological diseases. It may happen because of infection. It may happen to exposure to toxins and different deficiencies of vitamins and nutrients and so forth. But we have to be able to understand what it is. And is it simply trauma? We're going to get into repetitive trauma to the brain and why it takes place. And I'm talking about little bitty traumas that add up over a period of time. Being shoved, hitting your head against something, repetitive boom. The old teasing. Do you lead with that head all the time? People used to tease me about that on an ongoing basis for whatever reason. Every time I turned around, I was smacking my head into something. Years ago, we were in Las Vegas. I was at a chiropractic convention. There was over 4,000 or 5,000 people there, and we were staying at a very, well attended conference at the Flamingo Hotel. I'm coming down the escalator, and I was standing backwards talking to one of my staff members. Escalators don't bother me, never have. I'm always aware of my environment. But for some reason, the old escalators have a little lip on the back of it, right? So I got down there. I couldn't have orchestrated it better. Both of my heels hit simultaneously, threw me back. I'm going down. Instinctively, I turned over, so I would go face down instead of back down. But my momentum and my head going straight like a spear hit a marble pillar. Trust me, the crack was heard all over the place, and it caused some significant problems. Not only did it rupture a disc in my neck, and I was being treated for that, but other things began to show up. Fortunately, we acted quickly. Fortunately, we were able to begin to reverse the process. And then I've had multiple accidents over time. So you would think with all the damage to this noggin of mine, fortunately it's made out of steel, and that I would be showing other things. My wife would tell you that, that's probably been showing up for years, but that's neither here nor there. But what I want you to understand is that if you act on something quickly, you can reprogram the body's ability to make sure it heals quickly, make sure it restores its normal function. But you have to understand what the possibilities are. And once you understand the possibilities, you can fix virtually anything. Join us on October the 9th and continue to listen over the next few weeks on understanding neurodegeneration. Because if you get it, you understand it, subsequently it doesn't become as fearful. Go into, if I can remember, I think it's British Medical Journal is where I saw this thing. And it's called Neurodegeneration, Understanding Neurodegeneration After Traumatic Brain Injury, and from the mechanisms to the clinical trials that they brought back. And it was very supportive. I was very surprised, and unfortunately, and fortunately, somebody's doing the work, but unfortunately, some of the good work is coming from overseas. And we really have to take the time. But the key points that you want to remember after any kind of brain injury, and again, I'm setting the stage for our next program. Traumatic brain injury is associated with increased risk of neurodegenerative diseases, including Parkinson's, Alzheimer's, and old age dementia. All-cause dementia increased around 5 or 1.5 times, and this is recently has been around that 5% of all dementia cases worldwide may be due to brain trauma injury. Now, if that's the case, it still comes down to what can be done about it. Why is my brain shrinking? What can I do about it? Well, we're going to talk about why that brain shrinks and what the nutritional patterns are that we're not getting, the increased risk and stress patterns that are there, the ongoing day-to-day challenges with no resolution whatsoever. We're not learning, we're not expanding, we're just adding to the pattern. The relative risk of Alzheimer's after a traumatic brain injury has been estimated in a huge meta-analysis at about 1.6 times similar to the estimates that were done earlier on. That's huge. That's huge. And, when you go down and you look at Parkinson's patients, and then, there's this thing that they finally came up with, it's called frontal lobe dementia. And there hasn't been a lot of studies there, but what they're saying is that frontal lobe dementia has risen about 1.5 to 4.5 times, depending on the severity of the injury, the amount of impact. You see a lot of fighters, and you're going to see it dramatically over time with these cage fighters, where they're getting their heads kicked in and bashed in and beat up and so forth. The frontal lobe dementia is going to exponentially increase over time. And we're going to show you why that's the case, but more importantly, what, in my opinion, can be done, should be done, and sometimes preemptively to turn things around. I hope I'm sparking a thought process. And when it comes to why your cognitive patterning may be working the way it should be, but more importantly, to get you to do your homework so you understand that there's something that you can do about it. check out the British literature, check out PubMed, check out Frontier, check out the Towson's letter and so forth. All those areas, there's a lot of information. You're going to get both sides of the puzzle. If it's written by independent researchers, there's a chance that they're telling you something that can be done. You're listening to my love of providing information, Ageless Health, and it's simply that. It's Ageless Health. Health is a do-it-yourself program. Remember, that's the name of my book from years ago, and it's still available, by the way, so if you'd like to pick up a copy of that, you most certainly can. Having said that, my dear friends, remember, I do this every week on an ongoing basis. We may do it even more often than that because I'm getting the itch to give you more data, simply for one reason only. I love you all. You deserve it. See you next week. Bye.